in the front, this angle, which is not as sharp as the angle in the back, it will also, Rick, move what? Up and down. You have that in your manual. Now I'm going to add the word rotation. Okay, rotation from the back. When we look at rotation of a rib, we're referring to the rotation of the rib in this manual, in this course, as if you're looking at it from the back. But I've also included that rib rotation as if you're looking at it from the front. But before we go to the front, let's just look at it from the back. What's going on with the ribs with respect to rotation from the back? If I take my rib on the right side, the 5th, 6th, 7th rib, and I move the front part up, that rib from the back, perspectively, from the back, is going into external rotation. It's coming towards you. It's leaving the body from the back. The superior edge of that rib is coming directly to me, not to the patient. From the front of that rib is actually going into the patient. That produces torsion. And the more you move that rib into the direction you're going in, the torque goes what, everybody? Up. Now we got two more words. We have two more words on the plate. We have rib rotation and we have rib torsion. And as the rib is rotating, the torsion is going to go up. Okay, we put our fingers together and we put those thumbs together and we're looking at the rib from the back. Remember, Tessa, you're looking at her back of her ribs. Stay. So the rib from the back, when I go into external rotation from the back, the top of the rib, the superior palpable edge of the rib, Stephanie, from the back perspective is going down. So that superior rib edge of that angle and that neck is actually, Stephanie, going down. The other from the front is going what? Up. The palpable part of that rib is going to be easier felt from the back at that point because the edge of that rib is going out and down. The edge of the rib in the front is going up and in. And together, collectively, accumulatively, what does that produce? Torque. Does that make sense? So now if I have both of those ribs going from the back into external rotation, your body is going into extension. And what do you lose, Chad, when the body goes into extension? Rotation of the ribs is lost. It's gone. All it is a sagittal animal going, jacking, a sagittal animal that's driving a fence post in the ground every time you take a step, because there is no rotation left. It's all taken up. The torque took it away. You're in soft tissue. You can't move. You're extended. And the system is saying, well, if you're so extended, how am I going to get you forward? I've got to use appendages now because my axial structure is locked up into rib external rotation. That's under serious torque, tension, and tightness, which makes you kind of grouchy. You got to figure out, how am I going to contend with that? So you got to get what, Stephanie? You got to create more tension to overcome that torque. What takes tension away from your body, Chad? So all we got to do is get the ribs to start to do what again? Rotate. We've got to get ribs on the right side to rotate differently than ribs on the left side. That's what we have to do. We have to promote that in our programs. We can't put people in pieces of equipment that have backs to them and assume that you're going to lay them on that piece of equipment, lock their ribs into one direction on both sides, and Tyler assume that they're going to be comfortable. That's just not going to happen. We don't like driving, we don't like sitting in planes, 50-seat planes. I hate this. You sit in these little planes and they like little sardines, and your ribs can't do what? Rotate. I get kind of anxious. As soon as I get up and move around, I'm better. I really don't have to go to the bathroom, but I got to get up to go to the bathroom just to get what going back in my life. Rotation. And you have ribs that have to rotate on ribs. Why do you think all that chondral bone there is in the front? Why is that shock absorption in the front? Why, Chad? For rotation. Why is there a neck here that's pivotal in the back? For what again, guys? Rotation. I don't see anybody yet putting in total rib replacements. Because you aren't wearing them out, folks. You're going to prevent total hip replacement if you wear your ribs out a little more. We have patients who don't know how to wear out ribs. They don't know how to what, Chad? Rotate. I just want to make sure we go over that. That's why when we look at this whole chest wall, we get kind of excited about, Stephanie, let's maximize rib rotation. That's what this course is all about. So if you look at your page and you forget about torque and rotation, and I say, Tessa, I'm going to rotate to the right, and I'm going to look at it from a posterior view. My ribs on the right side are going into external rotation. The angle of that rib from the back is going which way, everybody? Down. When I look at the side on the left, it's just the opposite. And that is gait. I'm doing it now with every step I take. And I don't think too many people can talk that language. And so I'm here to tell you, learn the language. If you really want to maximize thoracic rotation, then you really are interested in a runner. If you're not interested in thoracic rotation, I don't know how you can be interested in a runner. If you're really interested in gait, you'd be interested in whether or not those ribs are moving on each other in contralateral directions. And so when I go to the left, the ribs on the right, the ribs on the right are going into internal rotation. From which direction? The back. These ribs went down in the front, and I'm going to the left. These ribs went up in the front, and that's what I did on going to the left. From the posterior view, external rotations occurring from the posterior view on the left side. And that angle of that palpable rib is going which way, everybody? Down. The angle of this palpable rib is going to be going what? Up. Take another step and it just reversed. Take another step, it just reversed. That's rotation. If I turn the rib cage around, everything I had on the other side of this board has just been flipped. And that's what you have in your manual. If I started teaching you from the front, which we could do, you'd have to be looking at ribs as if you're looking at them from the front. And you could. There'd be no problem with that, Mike. Some people do. I could have started the whole course over again and just look at the ribs from the what? Front. And the terms would change. But that's why I had you hold your fingers up. Everybody hold their fingers up one more time. And remember what we did? You take your ribs and you move the, remember what we're going to do here again? We're going to move the top ribs up, and that's called what, everybody? External rotation. When we move the top ribs down, that's called internal rotation. When we go to the right, when I go to the right, I'm going to move my rib cage to the right from the back. The top ribs on the right side, the ribs on the right side are going to go up. The ribs on the left side are going to go down. That's what's important, Heather. That's called, I'd have to flip that screen around, external rotation on the right and internal rotation on the left. It's that easy. From that little rib angle on that neck, that's external rotation on the right, internal rotation on the left. If I go the other way, Tessa,